Hi everybody! Today we're going to talk about ADHD, but I'm going to talk about a little bit of a different presentation than we see typically. Very often I'll have a case where a parent brings their child to me and they say, you know what, my child's been diagnosed since they were little with ADHD, and we've tried medications and they've seemed to have every side effect in the book, and we just don't understand what's going on and we need help. And so very often when I run a QEEG on those patients, which again is that map that allows me to look at their different brain waves, instead of seeing the under-aroused brain that is typical in ADHD, I see something called an over-aroused brain or an excited brain. And so an over-aroused brain not only can present in the sense of ADHD in the atypical way, but also things like the child might have anxiety, the child might have tics, the child might have some OCD or compulsive behaviors, sometimes really ruminating over things. If something happens, it's really hard for them to let go. And to explain how that over-aroused brain works, it's almost like when you have a computer and you're on your computer and you have all the tabs open and you have all the circles going on all the tabs and you're trying to complete something, but you just can't because there's so much going on in the background. So that's what an over-aroused brain is doing. And that's why it looks like ADHD, right? Because their brain has all these other programs going on in the background and they can't attenuate or focus at the task at hand. So to help kids that have an over-aroused brain and have the challenges of focus and attention issues, typically what we do is we train their brain to go into the lower gears. And when we train their brain to go into the lower gears, their attention can improve because they don't have all this background noise going on. So neurofeedback can be really helpful for that population of children and adults who have ADHD and haven't responded to the medications, or especially if the medications had made them worse. Because typically stimulants are going to speed up the brain. And for 85% of kids who are diagnosed with ADHD and have an under-aroused brain, that's why you can see results with them. But for those 15% of kids who are taking those medications based on their ADHD symptoms, if they have that over-aroused brain, they're not going to do as well. And that's why you see all these side effects. So if this sounds like anybody in your family or friends, please pass along this information to others. Thanks again. See you next time.